Dear students, learners, and audience, today our is lecture about bleeding for emergency and first aid services, which is related to basic health first aid training course, which is the main common part of the first aid type, that is bleeding. First of all, we have to know the common types of bleeding. Bleeding means and flow of blood from any body part, which could be arterial, venous, capillary. Arterial pressure is a blood flowing from any artery. It is in bright red color due to high oxygen content. Venous pressure and venous related blood bleeding is, as the name indicates, is bleeding from the vein, mostly flow with low oxygen content. Similarly, capillary, as the name indicates, blood coming from the capillary, but it is slow in movement and it is rather darker in color. And there is no many types of emergency screenings for the capillary bleeding types. We can only heal it with normal first aid, like tap the area of the blood flowing circulations, and you can heal the wound after some time, because blood flow is very slow, and it is slower blood from a damaged capillary vessel. Additionally, bleeding could be external, like from skin scab, or internal, for example, from bone or organ injury. Basically, these are the basic two common types of bleeding. External, it could be external or it could be internal. And further three types, as we discussed earlier, related to veins, arteries, capillaries. First aid help for arterial bleeding is related to wrapping a cloth or any strip around the wound area, and you can apply pressure with either with hands or with any towel or cloth. You have to wrap the injured area, and you have to cover the area with more pressure. But if there you view that if there is any object embedded in the wound, do not try to remove the object. Instead, you apply pressure around the injured area. For example, leg or any arm injury. In case of leg injury, you can apply pressure around the any knife related area or any object related area. You can also use a strip or your belt to turn around the areas and to secure the body organs, and keep legs elevated if the patient is not feeling well, and help him or her to cope this emergency. And immediately you should call any doctor or paramedical staff or rescue 911 to help as soon as possible. The pressure flow is very high in case of arterial pressure bleeding, so use direct pressure on an artery along with elevation and direct pressure on the wound. So, what is the first aid for an arterial wound? As I discussed earlier, cover the wound as long as no impaled object are protruding from it. Ideally, a sterile pad or bandage would work best, but use whether or whatever you have available, so long as it's clean. Means you can also use any clean towel or cloth if you don't have any bandage available immediately. Apply direct and constant pressure to the wound. If the victim is conscious and can assist, this will help. And if the victim has some choking behavior, try to protect him or her from choke, and turn him around to avoid choking. So this was a basic help for the arterial bleeding. You can see in the picture the common hemorrhage classification of arterial, venous, and capillary regions areas. Means that we have discussed and we have learned about arterial bleeding first aid techniques today, and also we will learn the venous and capillary bleeding first aid helping tool mechanisms. So you can see clearly in the picture the sporting blood and high blood flow and bright red color, because bright red color is due to the high level of oxygen in the blood, in capillary in arterial pressures. Now we will discuss about first aid for capillary bleeding. External bleeding types, as we know that capillary means oozing, flowing, and sporting. Flowing means flowing pressure in the area of venous region, and arterial in the sporting types. So, sporting way, blot the area with a dressing pad and apply direct pressure if the bleeding has not stopped on its own. So you have to thoroughly clean the wound with any soap and water, and apply the counter triple antibiotic to the area using a clean dressing pad. But if you do not have any dressing pad, you can use any clean cloth or any towel to avoid any further damage or loss. Capillary bleeding include example is very common, is the nose, normal nose bleeding example. It could be anterior region from, or if from anterior region, or it could be from posterior region. Do not backward your head area, but you have to forward, you have to lean forward to avoid further nosebleed. The most common kind of nosebleed is an anterior nosebleed, which comes from the front of the nose. Capillaries are very small blood vessels that are inside the nose, may break and bleed, causing this type of nosebleed. Another kind of nosebleed is a posterior nosebleed, which comes from the deepest part of the nose. So, to avoid nosebleed, you can also pinch the area between the nostril, upper side of the nostrils, and the head region. And to avoid nosebleed, you can put cold ice on your head, on the patient or any victim head area, to prevent from the nosebleed. But if the nosebleed comes, do not lean backward, but you have to lean forward. You have to keep your head forward direction. And you can also use medicated sprays as prescribed by your doctor in case of emergency, to avoid further bleeding. If the bleeding doesn't stop, you should 15 to 30 minutes, you should immediately contact further from any medical assistance. First aid nosebleed, here are some precautions. Sit straight and lean forward slightly. And nosebleed prevention include the air dry humidifier applications in your room, and you can coat inside of your nostril with Vaseline or any saline nasal gel 2 times a day, especially at night. So here, what the common precautionary measures about the capillary bleeding areas, and the many types of venous bleeding areas. As we discussed earlier, that if there is a handkerchief or a gauze, you can cover the wound and apply steady firm pressure for 5 minutes. So there were three types of main types of bleeding, emergency bleedings, and their first aid helps for the emergency conditions. So thank you guys for listening my lecture, and you can enroll and share further for my next sessions and lectures, and you can share with your friends and families to know, so that they should know basic knowledge about the first aid techniques. And you can also subscribe my YouTube channel name Ice Beats, and YouTube one. So it will encourage me to make more informative videos for you. Thank you.